Hi, I am Dr. Chava Anjaneyulu, Chief ENT Surgeon and Chairman for Asian ENT Care Center located in Panjagutta, Hyderabad. Nowadays, many patients are coming with the problem of tinnitus, dizziness and hearing loss. These three symptoms are common in acute problem and some chronic problems also. If you come to the acute problem, the common acute problem is the acute viral labyrinthitis. In acute viral labyrinthitis, patient will have symptom of severe dizziness, sudden and severe dizziness, and tinnitus, abnormal sound in the ear in absence of external sound, and hearing loss. Patient have panic attack, maybe you will have stroke, like that symptoms comes. Most of the times whenever patient have these symptoms, the common reason is the viral labyrinthitis. But always if patient is more than 30-40 years, it is better to do MRI of the brain and temporal bone. Because rarely sometimes tumors, sudden increase in size of tumor, or some severe purulent infections or brain strokes may cause this same symptoms. So if patient comes with these symptoms, start the medical treatment and do the radiological investigations as much as possible early. At the same time, you have to do the color Doppler study of the neck vessels. In color Doppler study of neck vessels, especially if the patient is obese or any hyperlipidemias and cholesterol is increased in blood, these patients have the problem of the carotid vessel atherosclerosis. That means there are patches in the carotid vessels, that may be common carotid artery, internal carotid artery. These patches will get dislodged and lodge in the brain blood vessels and cause reduced blood flow to that area, especially inner ear vessels. If the inner ear vessels gets thrombosed, we call it as a transient ischemic attacks or thromboembolic phenomena. Patient will have severe vertigo, tinnitus and sometimes hearing loss. So these are the acute problems. Coming to the chronic problem, the common chronic problem which cause dizziness, tinnitus, hearing loss is the Meniere's disease. Meniere's disease is a inner ear problem that we call it as endolymphatic eye drops. Whenever there is a increased pressure in the inner ear, it will give these symptoms: sudden dizziness, tinnitus, hearing loss. Especially this problem comes in the early morning hours. The other common reason is the exposure to the very cold weather. This cold weather causes constriction of the blood vessels in the inner ear and cause these vertigo, dizziness, tinnitus problems. Sudden loud noise exposure also cause the hearing loss, tinnitus and dizziness. Because with the sudden loud noise exposure, it will cause the constriction of the blood vessels and physical damage to the inner ear cells. So these are the common reasons whenever patient comes, depending on duration of the problem, depending on the predisposing factor and history, we treat and we cure these problems. Usually if acute problem, patient comes in a days, easily we can rectify with the medical management and ear canal injection, that is transtympanic injections. But to treat chronic problem, it may take time, but we can treat the patients, we can reduce their symptoms by medical treatment, by physiotherapy, vestibular rehabilitation exercises and intratympanic injections. So if patient have any problem of vertigo, tinnitus, hearing loss, contact Asian ENT Care Center. There they do all necessary investigation in cochleovestibular lab, radiological investigation. According to the reports, they will diagnose the problem and they will treat you.